So, healthy mind stays in healthy body, right? And as females, I believe, even myself, I'm a gynecologist, we do neglect our health. Females neglect their health most of the time. I'll ask one question. Do you get your husband's full body checkup yearly? Yes. All of you? Right. अपना कितना लोग कराते हैं? I think 30%, right? उसमें से फीमेल रिलेटेड चेकअप कितने लोग कराते हैं? Hardly 5%. So this is the actual statistics. The reason is awareness is not there. First, we don't know actually there are so many diseases in females, so many problems we go through. Starting from the when a girl starts having her periods, starting from menarche till menopause, at every stage the female body changes. So जो problems आती हैं, we don't know, we think it is normal, okay कुछ नहीं, मैं को थकान हो रही है. You are teachers, I'm sure आपका lifestyle बहुत ज़्यादा stressful है, right? You must be sitting at the time of lunch. Lunch का proper time नहीं मिलता है. I'm not having time. I'm not able to have time for my kids. मेरे को खाना भी मैं properly नहीं खा पाती हूँ. शाम को एक बार खाती हूँ. Questions and answers like this, right? So this is the wrong perspective. We start feeling okay now. I'm 30 plus. थकान तो होनी ही है. मम्मी को भी होती थी. Hair fall is normal. होगा इस age में. No, these are some of the symptoms we neglect. Okay, now let's start. And I have shared a questionnaire also. I think you all have filled up. Yes. Okay. Please, you can finish this. Thank you. Anyone, any computer teacher is here who can help them? They are not able to connect it. Let's start now. of women's health. Okay, it's not only the bodily health. There are many dimensions to women's health. What are all those 6 dimensions? We should be healthy as you people are teachers. Intellectual health. When you succeed in your intellectual growth, you feel satisfied. Spiritual. We should spend some time for our spiritual growth also. All these things gives us satisfaction. Emotional content. Spending time with your family, with your husband, with your kids. Occupation. If you're not satisfied with your job, you want to switch your job, you will feel irritated all the time. You'll not be happy whatever you are doing in. Physical, most important. We don't spend time. I tell you, previously, I think 20 years back, if you ask your mothers or grandmothers, everyone used to go for walk. It was a routine activity. Nowadays, we people say we have so stressful life, so much work pressure, I have to complete the assignments, I don't get time for work. So we don't spend time in our physical well-being. And joining a gym for 1 month and then not doing anything for 10 months is not the answer. Social interaction is very important, very important. You are teachers, you people must be hanging around with your friends and all the breaks and all. It actually, it relieves your mood. It is very important. It should be in a positive way, and I know you people are queens in that, but it is a very important aspect for female. Actually, it's very important. So these are the 6 dimensions of women's wellness. Now, what is wellness? Only about the body. Mind should also be healthy. And health of the family, this is the most important thing. We are the pillars. You people are the pillars of your family, pillars of your country. The health of the family is dependent upon the health of the female. The day you will feel healthy, you will not go back home in a tired way, you will cook food well. Otherwise, you will ask your kids, chalo, aaj bahar se kha lete hain. I'm very tired. This happens, right? So your health is most important. Now, for every age group, हर एज ग्रुप के लिए अलग अलग डिजीजेस हैं, अलग अलग हेल्थ इश्यूज हैं, अलग अलग प्रॉब्लम है. One size does not fit all. If there is one patient with, suppose I'm giving an example, किसी को एक infertility problem है और एक और लेडी को infertility problem है, they're discussing their problem. She'll say मुझे डॉक्टर ने ऐसे दिया, मुझे ऐसे. So actually for everybody, every female, every disease works in a different way. Fine. Like our own body, किसी के बाल अलग है, किसी के ऊपर कोई ट्रीटमेंट कैसे काम करता है. Similarly, same is for the treatment and diseases also. So for a 20-year female, the supplements, the investigations, क्या क्या हमारे concerns हैं वो different होते हैं, like for 30, 40 and 50. So lifestyle disorder, all of you are working here, most of you are working here, right? 60% working women suffer from lifestyle disorders. It is so common. People think I am not able to lose weight. Reason being, I have a sitting job. That's why सारा जो belly fat है वो increase हो रहा है. Actually, she is having hypothyroidism that is not diagnosed. She feels मैं बहुत थकान लगी रहती है मुझे because I'm not giving time for myself. मैं ठीक से सो नहीं पा रही हूँ, snoring बहुत हो रही है, weight loss भी नहीं हो रहा है, and my hair fall is also happening because I'm not able to take care of my hair. Actually, you may be suffering from PCOS. So awareness is very important, and if you are having any kind of issues, it's very important to discuss with a healthcare provider. Obesity, diabetes, hypertension, polycystic ovarian disease. Now this polycystic ovarian disease, I think most of you people are in your 30s. Anyone in 20s? Some of you are in your 20s also. So this is one disorder. This is an epidemic now. You may be having your girls also. आपके girl child भी होंगे, घर में कोई ना कोई girls होंगी, society में होंगी. This is very common nowadays. 20 years बैक ये डिजीज के बारे में किसी को पता ही नहीं था. Once in a while कोई केस आता था. आज की डेट में it is so common in girls, so common. Every 1 in 5 girl is having a PCOD. Chronic backache, obesity, infertility, depression, anxiety disorder. These are the lifestyle disorders. When we stop taking care of ourselves, we start getting all these things. Now, pregnancy, very important. All of you are married? No. All of you are married? Most of you are married. Okay, that's good. So you have more stress then. You are more stressed. It's very important to get married at the best age, I say. Not early, not late, the best age. Fine. This is not the only reason that you have not got a partner, a good partner. Something medically are also important. Fine. For your girls, if you will plan. Reason being, after certain age, especially after 30 years, जो fertility rate होता है, वो कम होने लगता है. जो eggs होते हैं, वो कम होने लगते हैं. And not only the quantity, it's about the quality also. The quality also starts reducing. And some diseases starts increasing. So that is the reason पहले के टाइम में इतनी ज़्यादा genetic diseases कुछ भी नहीं होती थी. कभी सुना ही नहीं था. Down syndrome, never heard. Dyslexia, never heard. Now why it is common? Because of this late marriage. And most importantly, delayed childbearing. You are getting married, but you want नहीं अभी 2 साल नहीं, 3 साल नहीं, 4 साल नहीं, आराम से we get married. We get the baby. So please don't delay the issue. This is very important. As the age increases, the risk of yes, IVF is the treatment. Infertility के बहुत सारे treatment आ गए, but उनकी risk भी उतने ही associated हैं. So when we can get something naturally, while we are talking about the session is all about women wellness. It's about your holistic care. अगर हम किसी चीज को prevent कर सकते हैं, that's the best measure. Prevention is always better than cure. Miscarriage rate and the anomaly rate in the fetus, in the baby, increases with the age of the mother. Now, this is a very important slide for all of you. If you can take a snapshot also, it will be good. Any one of you having mood swings? Many. Headache, night sweats, food cravings, acne. My skin was absolutely plain. Now I have started having all these eruptions. Insomnia, रात को नींद नहीं आ रही अच्छे से. Tiredness, fatigue all the time. You slept well, still I am feeling tired. Weight gain, not able to lose weight. Ma'am, I have not eaten. I was eating my normal routine food, but still I am gaining weight. So this is hormonal imbalance in your body. Now this hormonal imbalance, females में there are two important hormones, estrogen and progesterone. There are so many reasons this hormonal imbalance can occur. It's not only age. ऐसा नहीं है कि menopause पे होगा. Stress, it's actually related from the brain. These hormones start coming. The main channel starts from the hypothalamus, brain. Okay. So any stress, any anxiety can also cause hormonal imbalance. So if you are having these kind of issues, some problem is happening in your body. Don't neglect them. Now, I'll tell you some important points, some important topics that are important for the females. Then we'll discuss age-wise. For a 20-year female, what should be done? For a 30, for a 40, for a 50. Okay. Now, have you heard about LDC? Pap smear. How many have heard about pap smear? I think 10%, 8 to 10% hands, right? This is a test. It's for years in our country. India is the country where cancer cervix is the most common cancer of the reproductive system. The guidelines, Indian guidelines have incorporated this test for every female and see what is the awareness. You are the most educated lot of all. I take these awareness sessions especially for teachers because you teach masses. And just think about people, you people don't know about this pap smear because this is lack of awareness. And maybe it is the fault of our medical fraternity that we are not able to spread the word. So every female, Like we have BCG vaccine for children. Similarly, for female, liquid, this is called, previously it was called pap smear. Pap smear के नाम से बहुत लोगों को पता होगा. Now the technique has changed. We do LBC. LBC is liquid based cytology test. It is mandatory. Every female should start getting this test done from 25 years of age, every 3 years. This is done to, you can see, this is the cervix, this is a normal cervix, and this is an abnormal cervix. So if you are having an unusual vaginal discharge, okay, excessive vaginal discharge, you are having itching, you are having in the female's body and cause cancerous changes. Why we do this test? It is a preventive test. We actually do it, we catch these changes. It's a very simple test, painless, no. Yes, it is absolutely pain-free. It is an OPD procedure. You can come to me anywhere. You can go to your gynecologist. She'll do it in OPD. No measures required. You don't need to prepare yourself. You can go anytime, and this test can be done. Not during periods, except your period time. Fine. It's a very simple test. Hardly takes 30 seconds and saves lives. This test detects cancerous changes in the pre-malignant stage. जब तक ये कैंसर बना नहीं होता है, उससे पहले ये इसको डिटेक्ट कर लेता है, so that we can treat. Now one vaccine has come for girls that is called. I want to actually do some drive for this. That COVID vaccine, HPV vaccine is there since so many years. But still people don't know, people don't get their girls vaccinated. It is, the studies are saying, the data is saying, even one shot can reduce the risk to 80%. That is very good. This vaccine is given for girls from 9 years till 35, even 40 years also, but it is best to give 9 to 25 years. Best to give 9 to 25 years. The actual concept is should be given before the sexual activity. So 9 to 25 years, 3 doses or 2 doses from 9 to 15 years. It is given intramuscular, muscle में देते हैं, no side effects of the vaccine, but it saves the girl, it protects the girl. Screening will be continued. This LBC will be continued, but we will protect her. Fine? Now, these are some alarming signs. As I discussed, if you are having unusual discharge, you're having a persistent discharge, आपके बीच में कुछ लोग डॉक्सीमेट्रो कोर्स करते हैं, एक आधा गायनेकोलॉजिस्ट से कंसल्ट करके जिन्हें डिस्चार्ज की प्रॉब्लम होती है, स्पेशली you people are using bathrooms, right? They are common, so there is high chance of urine infection also. Bleeding after menopause. Menopausal females, जब आपके periods बंद हो गए हैं, you should not have bleeding. आपके periods 47 to 50 years तक बंद हो जाने चाहिए. अगर नहीं हुए हैं तो ये भी abnormal है. Unexplained weight loss, pain or bleeding after intercourse, abnormal vaginal bleeding, pain in the legs, backache. Even this is a very minor symptom, backache, but it can be associated. And discomfort while urination. So these are some alarming signs of CA cervix. I'm not saying if these signs are there, that person is having CA cervix, but these things need to be addressed. Now, second is be breast aware. Breast cancer is the most common cancer in India, in females. Every 13 minutes in India, one woman is dying of breast cancer. I'll discuss one case. One patient came to me, she is pregnant, she came to my clinic. Now, while going, she got her treatment done and everything. She said to her mother-in-law कि मम्मा आप बता दो डॉक्टर को एक बार बता दो. तो उन्होंने बहुत हेजिटेट करके मुझे बोला कि मैम मेरे को एक छोटा सा कुछ नहीं गांठ है ठीक ही है कम भी हो रहा है साइज में. कितने साल से है आपको? मुझे ये है 1.5 साल से. She was having a lump for 1.5 years. She never told her son. अभी शादी हुई थी, डॉटर इन लॉ उसको उन्होंने शायद डिस्कस करके बताया. Now I examined that. So we do a test for detecting breast cancer. That's called mammography. उसमें हम स्कोरिंग करते हैं. उस स्कोर में अगर स्कोर हाई होता है तो the chance of malignancy मतलब कैंसर बढ़ जाता है. I saw the lump. I said, "This is not normal. Please, our mammogram." And she was 50 plus, so all the more high risk for breast cancer. Now the family was not convinced. The son said, "नहीं नहीं मैम ये lump है, ये कुछ नहीं गांठ हो गई होगी और हम होम्योपैथी ट्रीटमेंट 2 वीक्स के लिए ट्राई कर रहे हैं एंड देन फिर हम देखते हैं 2 वीक्स में जो होम्योपैथिक है उन्होंने बोला ठीक हो जाएगा." Now the person called me and asked for an oncosurgeon's opinion. Please ma'am, you suggest me an oncosurgeon. This came out to be CA breast. So this is the neglect that is there in our society. And sometimes we as females, we are suffering from so many issues, but we don't tell our kids, our husbands, we neglect that. And sometimes we don't accept it also that it is an issue. That's the main problem. The problem actually lies in us. We should never portray anything on anybody. If I want to achieve something, I will achieve. Right? Anyone can do it. So the problem actually lies in us. We delay the things. So if any difference, you should discuss this with your doctors also. कुछ problem लग रही है, कुछ भी abnormal feel हो रहा है, they should discuss with you. So if you are in your 20s, yes, every 2-yearly blood pressure checkup should be done. Every 5-yearly cholesterol should be checked. Now, mind you, if a girl is thin and her eating habits are not good, she can have hypercholesterolemia. That's called high cholesterol level. So it's not about बहुत लोग बोलते हैं इनको तो वेट लगता ही नहीं है, इतना खाते हैं तो कहीं और लग रहा होता है, वो आर्टरीज के अंदर लगता है. Sudden cardiac death, heart attack especially is more common in the males. Fine. They have only truncal obesity. बाकी पूरे lean and thin होते हैं and high risk of sudden cardiac death. So if someone is not gaining weight, that doesn't mean that food is not going inside. वो बहुत sweets खा रहे हैं, fat खा रहे हैं, कहीं ना कहीं वो actually arteries के अंदर block कर रहा होता है. Fine. So cholesterol test is very important, irrespective of पतले हो या मोटे हो. Family history. This is for me. When I take your history, for me, your family history is very important. Some cancers, some diseases run in the family. Pelvic examination. At the time of marriage, one pelvic examination. Pap smear every 3 years or 5 years. Now we have added one more test. When we take that pap smear, we used to see the cells. Okay, like in COVID, RT-PCR and rapid antigen, 2 types of tests, right? So similarly, for this, 2 types of tests came. One is LBC, you detect the changes, and the second test, a little bit expensive, you detect the virus itself. So when we add that HPV virus testing, okay, HPV DNA testing, we can repeat this test 5 years. Self-breast examination. Okay, now this is very important. We have to protect ourselves from 2 important cancers, that is cervical cancer and breast cancer. Breast examination to be done by yourself from the age of 20 years. Girls nowadays are very aware and there are so many, I think awareness has increased now. So people do it and it should be done after the age of 20 years, after your menstrual period is over. Every girl should do a self-examination. Why it is done? To get acquainted what is your tissue type. So whenever any abnormality comes up, you will be able to pick it up. Discuss about diet and birth control. If you have got married, you are spacing pregnancy, abortion is not a good method. So please use some birth control. And you have to continue all these things in your 30s, 40s, and 50s. Now, for 30, one added test. Now, diabetes start coming. So, it is the glucose test. We should get a fasting glucose test. Thyroid problem starts coming after 30. TSH after 35 years is a thyroid stimulating hormone test, TSH test. Now, hypothyroidism, mind you, if someone is having, it stays with you. Yesterday, a girl came to me, she started crying. She was 35, said, Ma'am, mujhe hypothyroid hai. Why? I will pop a pill every day. I don't want to do it. And she stopped. She started having her menstrual irregularity, not able to conceive. So, these are some, see, lifestyle disorders like diabetes, hypertension, they stay with you. We have to deal with it. And इसमें ऐसा नहीं होता कि value ठीक हो गई तो आप ठीक हो गए. You have to continue the medication, and if you are stopping it, it should be discussed with the doctor. Pelvic examination, pap smear, and now the role of clinical breast examination comes. You have to go to a gynecologist for a clinical breast examination. Clinically, you should get your breast examined every, either with your pelvic examination yearly or even 3 yearly will do. In 40s, one added test, we have to do all those things. Plus, now the cancer breast risk increases after 40. So, all the females, please get your mothers also and your mother-in-laws also screened. Mammography to be done every year. Now, these are screening. What is screening? Screening का मतलब होता है कुछ ऐसे टेस्ट करना जब कोई सिम्टम नहीं है. सो इसलिए कन्विंस करना बहुत मुश्किल होता है लोगों को. वो बोलते हैं मुझे कोई दिक्कत नहीं है, क्यों करवा रहे हो ये करवाया इसलिए जाता है so that we can detect at the early stages, so that they don't go to stage 4 directly and we can't save the life. That's the reason. And in your 50s, now these tests to be done, yes, we'll stop it also, we can't keep on doing it. So mammography till 75 years and pap smear till 65. Now one more test added, ये अब आपकी menopause age आने लगती है. Now Indian standard age of menopause is 47. ठीक है, जैसे periods जल्दी होने लग रहे हैं अब गर्ल्स के 9 years 10 years पे स्टार्ट हो रहे हैं, पहले लेट होते थे. Similarly menopause भी जल्दी आ रहा है. It's all because of our lifestyle problems. So we have to get one more test done, that is called DMD test. It is the bone mineral density. I am sure very less number of you must be taking calcium supplements. कौन लेता है? चलो कोई. कितने months के लिए लेते हो? 3 months. कब? कितनी बार? Once in a day. Once in a day. Once in a week. Once in a week. Yes. Once in a day. Okay. Calcium should always be taken with vitamin D. Yes. Never to be taken alone. It should not be taken continuously. Doctor prescribes for 3 months. It can be 2 months according to your values. Now it should not be कि मैम मैंने अभी बंद किया तो फिर ले लूँगी, क्योंकि it's very easily available. So people keep on taking it. It also increases the risk of stones. Right? So बहुत ज़्यादा नहीं लेना. Every year for 3 months, it is the best dose. After the age of 40 or 35, always supplement it with vitamin D. Now this calcium has to be taken daily, not weekly. Vitamin D has to be taken weekly. Fine. Now this is prophylaxis. मतलब कि आप normal हो, फिर मैं आपकी body को supplement कर रही हूँ. जहाँ deficiency आ जाएगी, then we need to increase the dose, and this you cannot take by yourself. Okay. Now, some needs to be addressed. Vaginal discharge, please don't neglect it. Any kind of vaginal discharge. There is a physiological discharge, जिसको हम euphoria बोलते हैं. That is very small in amount, creamy, odorless. Now, when your discharge starts bothering you, it is a problem. You have to get it addressed and checked. Urine tract infection. Now, mind you, people are using public washrooms. Fine. Females are more prone to UTI than males. Why? No, we don't sit. Our urethra is very small. Ours is 4 centimeter, theirs is 20 centimeter. So when we get infection, it's very easy to go into the bladder, into the ureter and the kidney. We are more prone. Second reason is the water intake. Please don't reduce your water intake. We tend to reduce our water intake. The UTI chance increases during this cold weather. लोग पानी नहीं लेते हैं. Fine. So don't neglect it. Urinary leaks after certain age, normal deliveries के बाद बहुत लोगों को थोड़े थोड़े यूरिन लीक होने लगते हैं. ठीक है? कफ के साथ, स्नीजिंग के साथ. So this is a problem. ये normal नहीं है. Irregular periods. Any time of your life, if your period pattern. Now for period, one thing is important. सब फीमेल्स भगवान ने अलग बनाई है, तो सबका पीरियड पैटर्न भी भगवान ने अलग बनाया. तो कभी कोई दो फ्रेंड्स बैठ के डिस्कस करें कि मेरा तो 2 दिन होता है और तुम्हारा 7 दिन होता है, नो पॉइंट. अगर किसी का 2 days होता है हमेशा से, सो वो 2 days उसके लिए उसका नॉर्मल है. किसी का 7 days होता है तो दैट 7 days आर नॉर्मल फॉर हर. नाउ इफ इट गेट्स स्विच्ड, 2 days वाली का 7 दिन होने लगे और 7 दिन वाली का 2 days, then it is. So whatever is your period pattern, that is the normal period pattern for you. Now, if it is changed, 3 months से आपने notice किया कि मेरे periods अब थोड़े कम हो रहे हैं, या spotting हो रही है, या फिर frequency कुछ duration बढ़ गए हैं, so now it has become some abnormality levels emerged. Now, some vaccines are important in females. One is HPV vaccine, as I discussed. Second is, this is a pregnancy vaccine. Many people ask कि मैम TT ही देना होता है. No, now we have a very good vaccine that is called TDAP vaccine. We prefer giving this to females. Flu vaccine is an influenza vaccine. Influenza shot should be taken before the influenza months. And yes, of course, the COVID vaccine. COVID is absolutely safe in feeding, in pregnancy, in lactation, any period you can take the COVID vaccine. HPV should not be taken in pregnancy. If you are planning pregnancy, then schedule your HPV at some later date. Now, there are 3 periods of your life during the menopause. Perimenopause, हॉट फ्लैशेस सबसे बड़ा एक फेज आता है. फिर पोस्ट मेनोपॉज, सबकी अलग अलग प्रॉब्लम्स हैं, सबकी अलग अलग सिम्टम्स हैं. द मोस्ट बॉदरसम सिम्टम इज हॉट फ्लैशेस. गर्मी इतनी लगती है कि बर्दाश्त के बाहर होता है. यू आर इन एसी, यू आर हैविंग, एंड आई टेल यू इट्स नॉट ओनली फॉर ओल्ड एज. यंग फीमेल्स में भी हॉट फ्लैशेस की प्रॉब्लम होती है जिनको मेंस्ट्रुअल इरेगुलरिटी होती है. We do have HRTs, we do have treatment, we do have help at that time. Please take help. It is a very difficult stage of life. Females become irritable, they don't want to talk, कुछ अच्छा नहीं लग रहा है, खाने का मन नहीं कर रहा है, पूरे टाइम घबराहट हो रही है. So we do have treatment. Please get in touch with your gynecologist during this difficult phase so that it can become easy for you. Yes, now diet. Diet is very important. Everyone wants to lose weight. Without eating, we cannot lose weight. So never do dieting. This is one concept. Eat local food. Avoid processed food. Anything that is coming in the packet is not good. Anything. One thing I was just yesterday I was listening to somebody. पहले के टाइम में कितना it was very difficult for when we were kids. अगर हमें पिज्जा चाहिए होता था या फिर बर्गर चाहिए होता था, कितनी हिम्मतें करनी पड़ती थी पेरेंट्स से. I belong to a doctor family, so मुझे तो 90% लाने पड़ते थे to get a Neverlast की आइसक्रीम और anything. So इस तरीके से होता था. एग्जाम्स के बाद मिलता था ऐसे कुछ. मतलब it was once in a while वाली चीज है. आज क्या होता है? We get that McD burger. You have so many students that every day they are having a burger or something. So this is the life. Let's start avoiding it. Try to make some interesting food for your kids so that they don't take it. Eat local, eat fresh, eat with your sense. Mindful eating. You should not gobble up food. Mindfully eat your food and small frequent meals. Even if you want to lose weight, keep on eating small frequent meals. Reason is it increases your metabolism. आपका digestion increase होता है. So we should have small meals frequently. And yes, now supplement. Calcium, vitamin D we have discussed. There are some more supplements for females for skin, collagen that is coming up. If we start taking supplements the way I have advised, you start eating local and fresh, you will never need biotin and collagen. Look at your mothers and nannies and daddies' skin, they used to glow like anything, right? And we have faded skin at 30 also. It's because of our diet. Whatever, if you apply anything from outside, it won't work. Whatever you're putting inside will work in your body. Yes, I love this quote by Michelle Obama. Being a healthy woman isn't about getting on a scale or measuring your waistline. We need to start focusing on what matters, on how we feel, and how we feel about ourselves. Yes. Thank you so much for your time, and I would be happy to answer any questions if you have. Yes, please.
I have a question. It's not regarding me. It's regarding my daughter. It's been
What's her age?
she's 14 years old, and the thing is that for whenever she has periods, like it is always 10 days gap.
Hmm.
So is it something like I have to
See,
consult
for the first 2 to 3 years, जब मिनाकी बोलते हैं, so it is very normal if a girl is having irregular periods during the first 2 to 3 years of her life. कभी 10 days overdue हो रहा है, कभी 2 months भी हो सकता है, कभी 3 months बाद आ रहा है.
thing is, it's not irregular. Whenever, like, suppose the date is 20, it will be
Come on,
next
30.
month. It will be on before. It will be on 10th.
So it is short cycle. Then you should show her, and because then that means she's bleeding frequently. She's bleeding every 20 days, now.
Yeah.
She's bleeding every 20 days. So and then the blood loss, iron deficiency, everything will come on. You should get this checked. I sit in Sharda Hospital also. I'm a professor, assistant professor there. And if you have any other queries, please tell me. I hope this session helped all of you.
Yes.
Yes. Yeah, please tell me.
Yes.
Insufficiency. It should not happen. Reason being, जो hormones होते हैं, वो कम हो जाने लगते हैं 40 years से, जो कि होना चाहिए था 50 पे, right? So all the bone loss and everything starts coming up.
And what are the symptoms of menopause?
You stop having your periods. First is this, that's the most important symptom. Hot flashes, irritability, all the hormonal imbalances I told you will appear at the time of menopause. Yes, there are. And actually medications should be taken. Yes, anyone? I think I have addressed all the queries in the session only. Yes.
Ma'am, can you please talk about the thyroid test? Like,
Yes,
what is
actually, in thyroid test, there is a thyroid profile. We do T3, T4, and TSH. Okay, and sometimes we only do the TSH test. Suppose if you are a hypothyroid patient, I will do your thyroid profile. If you are pregnant, I want to do just a baseline TSH test. What is your thyroid status? I'll just do a TSH. And according to the level we diagnose, it is hypothyroid or hyperthyroid, and then give the medication.
So is there any gap for doing that? Like,
See, if you are diagnosed with suppose hypothyroidism, let's say, then we start giving you medicine and we repeat the test after 6 weeks to see that medicine, how it is working on you. Do I need to increase the dose or reduce the dose? So we do it within 4 to 6 weeks.
And ma'am, what about the regular checkups of thyroid? Like I'm facing it for like 10 years.
10 years. That's what I'm saying. Suppose आपका अभी जो भी टाइट्रेट होके डोज चल रहा होगा, वो डॉक्टर रिपीट करता है 4 to 6 weeks में, TSH रिपीट करते हैं. Now you are stabilized with one particular dosage. You can get it checked after 3 months or let's say 6 months. और आपको खुद सिम्टम्स आने लगेंगे कभी-कभी. आपके पीरियड्स में रेगुलरिटी हो गई है, मतलब आपका थायराइड इधर-उधर हो रहा है. You are again feeling fatigue, आपका थायराइड इधर-उधर हो रहा है. Then get yourself checked. That's all. I hope all the females will get their pap smear done. Please spread the word, and that's the only request from my side. If you can educate as many people, that's the best thing. Thank you so much.
thank you.